Tonight, one of the authors of a new study calls the idea that COVID-19 is sparing young people just false. Researchers looked at 48 children in intensive care. While a majority had pre-existing conditions, almost 1 in 5 did not. The research comes as concern is also growing over the rare new inflammatory illness, believed to be affecting children weeks after a COVID infection. As New York State is investigating 2 more deaths amidst 93 cases. Today, an alert to all parents of New York City school children.
We believe we can reopen schools safely and well in September, but we have to keep a very close watch on this syndrome to make sure that we attack it in every way possible.
NBC News has found cases in at least 11 states. The New York Genome Center is now studying the affected children, trying to determine what put them at risk.
If we knew the genes that are involved, it could really guide how these children are managed.
Symptoms include fever, rash, and upset stomach. Some can go into cardiac arrest. Andrew Lease was a healthy 14-year-old when he suddenly developed a fever and abdominal pain.
Did you know you had the coronavirus?
No.
In the hospital, his heart started to fail.
It brought me and my wife to our knees.
Doctors were able to save his life.
We do have strategies to manage the children, and they're uniformly doing very well.
I'm just insanely happy to be here.
Andrew now sharing his story as a warning to others. Kristen Dahlgren, NBC News, New York.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.